Hello, everybody, and welcome to the webinar today. It's Dr. David Alfonso coming to you from the Bankstone Center for Aesthetics and Plastic Surgery. I'm really excited to be able to share some of the new advancements in plastic surgery and techniques for enhancing patients' recovery. Especially today, we're going to focus on those patients who have had some significant weight loss in their past, either through diet and exercise or potentially some surgical procedures. We've seen a lot more patients over the years that have presented to us that have had significant weight loss, and surgery is very effective at kind of completing the circle of their complete transformation from the weight loss and then the extra skin that can often result from that weight loss. So we're going to go over a lot of interesting things today, and we'll have an opportunity towards the end of the webinar for any questions that people may have to write in on the chat box question. So let's go ahead and get started. As we always tell patients, credentials are obviously very important when you're picking a plastic surgeon and a practice. So my certifications are American Board of Plastic Surgery. I'm also a member of the American Society for Aesthetic Plastic Surgery, as well as a national trainer for Botox, cosmetic, and facial fillers. I've been honored and blessed to receive awards in the past in regards to patient ratings and reviews, and this just further exemplifies my commitment to achieving the best results possible for my patients. So why choose the Bankstone Center for your next cosmetic procedure? Well, between Dr. Bankstone and myself, we have over 35 years of combined experience in plastic and cosmetic surgery. We have an on-site, state-of-the-art accredited surgery center, which is accredited by the society called Quad ASF, and what that does is it basically certifies as to the safety and health standards in the operating room so that it would be equivalent to having surgery done in a hospital setting outpatient center. Our practice is one of the top 1% in the United States, and based on the volume of not only breast implants but also cosmetic injectable procedures, including Botox, facial fillers, as well as allergen products such as Latisse. We're very proud that we've been able to accomplish that and achieve that. So one of the things that we like to talk to patients about is the Fast Track Recovery Program. This has become much more almost the standard of care now for most outpatient surgery. And really the goal of this procedure of this approach is to enhance your recovery. One of the biggest barriers for patients to consider having a cosmetic surgical procedure is the fear of the pain and the discomfort after surgery and recovery. The Fast Track Recovery revolves around pre-treating patients with oral medications before surgery, surgical techniques which minimize tissue trauma and bleeding, and then post-operative activity which typically involved arm motion as it relates to the breast implant surgery and getting up and moving around and walking. When you combine all of these three factors together, it allows us to do many, many surgeries that used to require oral narcotics such as Norco and Vicodin to be able to provide these surgeries for patients and not use any of those narcotics afterwards. In addition, we use a lot of local anesthetic, which numbs the tissue, so when patients wake up, they're feeling very comfortable and minimal pain. Some of the other aspects of technology that we like to utilize here is the Vectra 3D imaging. We're one of the few offices that has embraced this technology and really made it a significant part of the breast analysis. It is a 3D camera which records the images of breasts during the consultation, and that allows us to look at the images and assess the volume, as well as show patients what their post-operative result would look like based on a variety of factors. The great thing about this is that patients love it because they can look at their results after surgery without even having had surgery yet. So it's a great technique. It's very accurate. As you'll see in this slide, the upper portion of the slide is a simulated image of a patient who was interested in breast augmentation, and these were performed in our office. After the patient had surgery with the virtually the identical implants, you can see the image below. That's an actual post-operative image to see how similar and accurate those images are. So it's a very effective technology that we use with our breast augmentation patients and really helps us to tailor the implant selection. In addition, other components of the Fast Track Recovery include our pre- and post-operative wellness kit. In collaboration with the Bourne Clinic, we have packets of vitamins that patients start to take before surgery, as well as afterwards. These vitamins perform a lot of functions for patients. Obviously, from a nutrition point of view, it helps boost their immune system and allow for as rapid healing as possible. And in addition, it has components in the vitamin that help with minimizing bruising and swelling afterwards. Patients have found that these have been very effective compared to other procedures they've had in the past before we were utilizing this recovery packet. So this is sent to all patients who end up booking their surgery to start before surgery, again, to optimize nutrition and health prior to the surgical procedure. The Fast Track recovery is included for all. It's the technique that we utilize, and it is included with all breast patients. It specifically relates to breast implant patients or breast augmentation patients, but the techniques such as utilizing numbing fluid and arm motion are also used with other types of breast surgery. In addition, the philosophy that is used there in terms of pre-medication and pain blocks, which we'll talk about shortly, is also used with our body contouring procedures. So here's an example of a graphic of one of our board-certified anesthesia doctors who's holding an ultrasound probe and injecting some long-acting local anesthetic into a patient who's asleep and getting ready before surgery to have a tummy tuck performed or an abdominoplasty. The benefit of this procedure, which is called a tap block, is that the local anesthetic is injected under ultrasound guidance into the patient's muscle layer, which helps to calm down and basically numb all of the nerves that travel to the abdominal muscle layer. By calming those nerves down and blocking them, when patients wake up, the traditional surgery used to cause significant discomfort. After the procedure is done, patients wake up feeling much better. This local anesthetic can last up to 2.5 to 3 days afterwards and has really allowed patients to have a much improved recovery. They're up and walking faster and getting back to normal activities much quicker. We're very glad that our anesthesia doctors are so well trained in fellowship and pain techniques to be able to offer this to all of our patients who undergo an abdominoplasty or tummy tuck procedure. Another new technological advice is the Interi system. This replaces what used to be termed basic surgical drains. It's the next generation of fluid removal system and internal closure systems. It helps to reduce the risk of postoperative complications by helping to remove extra fluid that can build up after certain surgeries. It optimizes the tissue interface or the tissues touching one another to promote healing in a faster manner, and also eliminates the potential for fluid accumulation after surgery. These typically are performed and used with surgery such as an abdominoplasty surgery. Almost all breast surgery, except for some very rare kinds, are done without any type of drain system or Interi system. Another aspect of technology that we embrace very readily here at the office is the use of high-resolution ultrasound imaging. This allows us to image patients who have had breast implants and determine whether or not they're at high risk if the implant has had any rupture or tear to the implant. It also lets us see some of the tissue surrounding the implant. It's a very easy procedure. As you can see, if you compare it to the other standard imaging modality for breasts, such as an MRI, there's very good comfort. It's painless. It's done right here in the office. Patients are wide awake. It can allow us to get a good sense of the shell of the implant and to see if there's any potential disruption. And if it is, we then would order a more definitive test before potentially taking the patient to surgery. Some patients have a pretty well-defined capsule on the ultrasound and can be very definitive in terms of if there are any issues with that. Patients who undergo breast augmentation surgery or breast revision surgery with the use of implants at our office, we offer lifetime monitoring of the implants with our high-resolution ultrasound system. So let's go into some surgical results. We're going to go look at some patients now who have had procedures, both the abdominal area as well as other parts of the body, focusing again on patients who have had some weight loss over a course of some time. So here's our first patient who came in the office and was concerned regarding some fullness on the upper and lower abdomen as well as the waistline. She felt that despite exercise and diet, she had lost some weight but couldn't really get the shape to come out that she was hoping for. And this is a patient that I performed a mini tummy tuck and liposuction on. Liposuction is removing fat only through small incisions and a cannula, and a mini tummy tuck means that skin was removed down in the bikini line area in the middle, but not a full tummy tuck. You can see here her results, which are typically, these photos are taken anywhere from 9 to 12 months after surgery. after liposuction, you can see her waistline is much more defined and has more definition and flattening of her abdomen. Here she is from the side view in terms of the waistline and the side view of her abdomen and the back area. This is a region that we typically like to address at the same time as doing procedures on the front. The back part here, we often term the flanks, and those are areas that often you'll hear them described as the classic muffin top area. They can be very frustrating for men and women because despite being very active, healthy, and doing all the right things, they don't go away. They are areas that tend to be resistant to changes in diet and exercise. As you can see in this patient, liposuction is very effective. She had good skin quality, and I removed fat in the bra roll area as well as lower, which can be a big advantage for patients. The philosophy that I take is to contour patients basically all the way around because it gives the best result and also creates more of that hourglass silhouette that we're trying to achieve. So we're going to go look at some more what we call full tummy tucks. These are patients who had more skin removed as well as muscle repair. And this is an example of a patient who had some widening of her hip area, some extra fat, and wanted to have a more slimmed down waistline and improved shape overall of her abdomen. Her picture shows her after result with her scar as well as her belly button, which we typically create a new belly button for patients following the procedure. Here's the patient's side view. In this particular patient, the scar was extended back to her back area a little bit, and you'll see in the next photo the benefits of doing that. So here's her back view. You can see those flanks were a significant problem or concern for her. And after performing liposuction, I removed skin in the back. So some tummy tucks go beyond the hip bones and actually go to the back, and some of them go all the way around the back to help with lifting of the buttock area, which we'll talk about in a little bit. These scars are typically very easily concealed in most types of bathing suits and underwear lines and really allow the surgeon to create the optimal shape for the waistline. Here's another example of a patient who had a full tummy tuck performed and with removal of extra skin. You can see the side view there, that lower hanging abdominal skin is now much tighter. And also she had tissue removed from all the way around. If you look closely, you can see the scar just creeping out above the photo underwear. I tend to like to design the scar so it stays fairly low and can be concealed by most types of swimsuits. Here's another example of a patient who had lost some weight and was left with some extra skin around the belly button above as well as below. She also had concern regarding her outer thigh area, which also was not amenable to a lot of changes that she had made in diet and exercise, which allowed her to lose that weight. Here's her result after a full abdominoplasty or full tummy tuck. She has a new belly button. Liposuction was also performed on the front of her abdominal area as well as the back in order to achieve great shape of her abdominal region. In addition, liposuction was performed of her lateral thighs to shape it in a more kind of streamlined fashion. Here she is from the side view. You can see how much flatter her abdominal area looks. And then here from the back, not only is her waistline better, but you can tell that her lateral thigh area, the so-called saddlebag area, which can be very frustrating for a lot of patients, has also been improved with the liposuction. Here's another example of a patient who had had some fairly significant weight loss and was left with extra skin hanging in the front as well as the sides. Again, a great candidate for full tummy tuck. This is also referred to as sometimes as 360-degree liposuction. That refers to basically doing liposuction all the way around the waist in addition to doing the tummy tuck. As I mentioned earlier, adopting these techniques allow me to create the optimal shape and contour for patients afterwards. You can see she has a much more athletic looking abdominal area. Her waistline has come down pretty significantly. Again, new belly button, and all the loose skin around her belly button and below has been removed as part of the procedure. Here's her view from the side. Again, if you notice that extra skin hanging down, that abdominal skin apron has been removed. And here she is from the back, which you can see a nice improvement in the flank area. And so if you don't address these areas in the right patients, then oftentimes you're left with a disproportionate result where they can look flat in the front, but they don't have the real ideal shape of their entire waistline, and also helps with fitting into clothes a little bit better. Here's another example of a patient who had lost some weight. You can see she has the classic findings, some stretch marks, loose skin around the belly button and below, and she was a great candidate for a full tummy tuck. In addition, you'll see in another photo I have of her that we also did some fat transfer. Fat transfer is a procedure where fat is removed from areas of the body, typically the hip area or the abdominal region or the thighs, and it's placed in another area of the body where we want to enhance the volume or improve the volume. This typically most commonly is done in the buttock area to help improve some of the projection and roundness of the buttock. It's also been referred to in the press and in other media outlets as a Brazilian butt lift. The procedure is done as part of the tummy tuck as well in those patients who choose to have it performed. In this patient also, 360-degree liposuction was performed to really shape and contour the front of the abdomen as well as the waistline. She also has a new belly button as part of the procedure. Here you can see from the side view, her abdomen is quite flat. It had a part of the procedure is the muscle repair, which we talked about earlier with the tap lock. That muscle repair allows patients to have a much flatter, tighter abdominal wall. Many patients who have had either multiple pregnancies and or significant weight loss, including male patients with weight loss, are candidates for having the muscle repaired at the time of the surgery. The benefit of that is that it improves the overall result and it creates a much flatter, tighter area in that region. So one of the other areas that patients oftentimes come and talk about are their thighs. As people are aware, when patients lose significant amount of weight, they receive all of the health benefits of losing that weight, such as improvement in their diabetes and blood pressure and other health-related factors. However, one of the issues that patients are often left with is extra skin, as we've been discussing earlier. The thighs can be a very challenging area for them as well. And as I tell all the patients who come in, diet and exercise are great and they're good for maintaining health. But once skin is excessively stretched and is loose, it cannot be exercised away. The only effective way to reshape the body at that point, once patients have been at their goal weight, is to do a skin excision procedure, oftentimes combined with liposuction. Thighs are a very common area that patients tend to complain about after they've lost the weight. Here's an example of a patient who had a thigh lift. So the scar for a thigh lift is actually located on the innermost aspect of the thigh where it meets the outer pubic area, which you can see in this patient is maybe visible. Her scars have healed really well, but it's also typically tucked in that area so that it can be hidden in the bikini or bathing suit line. This patient had lost a significant amount of weight, had a lot of looseness to the inner thighs. You can see on the photos afterwards, she has at the beginning, you can see a gap in her thighs, which would never have been possible without the procedure, the surgery to be performed for her. Liposuction was also done on this patient in order to enhance the outer part of the thighs as well. Here's the same patient from the view from the back. Again, if you pay attention to that upper inner thigh area, you can see a bigger gap between the thighs. And again, that is part of the procedure. Skin is removed from under the buttock and then extends into the front part where the skin is removed along the bikini line and pulled upwards. This is very effective at reshaping the thigh and helping with some of the looseness in that region. Here's another great example of a patient who had lost significant amount of weight. If you look at the photo, the before photo, you can see how her skin is literally just kind of falling off of her hip bones. She had maintained her weight very nicely and was very concerned regarding wearing a bathing suit or even short shorts because of being self-conscious of the loose skin that was in that region. She was, again, considered a great candidate for what we call a circumferential thigh lift, where the skin is relifted and tightened all the way around, including in the back and the upper buttock area, which we'll show in a few photos after this one. Pay close attention to her inner thighs, and you can see the big difference in the loose skin that was located on the inner thigh area, even down to the knee. This particular patient had a very, very good result in even helping with some of the loose, crepey, stretchy skin located above her knee area. She was a great candidate for it because she really had very minimal excess fat. It was really all of a procedure involved removing skin. Her scar, you can see extending from the upper thighs out to the outer aspect. Here's the same patient from the back view. If you look at what we would call the buttock fold area underneath the buttock cheeks, you can see how much loose, stretchy skin there was there. And now afterwards, the procedure that I performed also lifted the upper part of the buttock, and that's called a circumferential thigh lift, also called a buttock lift as well. The scar is barely creeping out over below the photo underwear line on the after image, and it blends in very nicely. Again, the key with these scars is that in order to accomplish significant change to patient's body and contouring, the scars have to be used because that's how plastic surgeons remove tissue. The key with the scars is having them heal as well as possible, and we do that by utilizing advanced techniques in wound closure and closing in multiple layers. In addition, the key is the art of hiding the scar in an area that's highly likely to be covered with underwear and or a two-piece bathing suit, and almost certainly a one-piece bathing suit. And you can see in this patient that she would definitely fall into that category. The other neat thing for this patient was, as you can see in the before image, she had very little tissue of her buttock, and that's a consequence of patients who often have weight loss. So one of the neat things that I do in the operating room for these patients is when I remove skin in the upper part of the buttock area, instead of throwing that tissue away, it's preserved on its blood supply and it's slid down to help reshape the buttock. It's what we call auto-augmentation. Auto stands for utilizing a person's own tissue, and augmentation means augmenting or improving the fullness of the buttock area. As you can see in her, it's not overdone. She's not going to walk around and look like she had buttock implants or anything over the top. It's really just a nice natural enhancement of the shape that she was lacking because of the lack of volume there. This is often done as well in my patients who come in and have a lot of loose tissue, and I talk to them about the benefits of auto-augmentation of the buttock area. Here in the next patient, you can see, again, similar outcome. This patient came in and was concerned regarding some extra fat on her outer thigh, as well as tissue on the inner thigh and extra tissue lower in the buttock region. So she was a very good candidate for a buttock lift as well. In addition, in her, I did auto-augmentation like we just talked about, which again is keeping tissue preserved, using it to round out and shape her buttock. You can see her scars again, very, very minimally creeping out from where the photo underwear line is on the right. She has a significantly improved thigh gap. Her shape of her outer thighs has been enhanced with the liposuction, and the lifting helps to reposition the tissue where it was prior to the significant weight loss. Here's her front view. You can see improvement in her outer thighs as well as some of the loose, stretchy skin on the inner thigh area. An overall nice improvement in the basic circumference or the whole area of the thigh from the front to the back. So in transitioning from the thighs, another area that patients oftentimes will complain about or have issues with are the arms. And so a brachioplasty is just the fancy medical terminology for saying an arm lift. And this occurs in patients, we do this in patients who have skin excess in the arm area, often extending into the armpit area. This is another common region of the body that can have significant loose skin following weight loss in patients. Patients who are considered good candidates for this procedure are those who are, again, at or near a stable weight and have been there for at least 6 to 9 months and have enough extra skin there that we can remove the excess skin and still leave a nice natural shape. This procedure has become much more common and popular over the years as more patients undergo significant weight loss. So here's an example of a patient who has loose, stretchy skin in the lower arm area. She was very concerned about it. And as I mentioned earlier, when skin is stretched to this degree, there is virtually nothing that can be done in terms of physical activity or weightlifting in order to get rid of that skin. That's the common theme that we talk to patients about, and I tell them is that it's great to have the weight loss, but the skin cannot be exercised away. But there are a great variety of surgical techniques and procedures in order to improve those areas. So with this procedure called an arm lift or brachioplasty, the scar is located from the inner part of the elbow along the lower part of the arm and into the armpit. The way that the scar is designed in her, as you can see, you can barely see it when she's holding her arm upright in that fashion. That is one of the benefits of the scar, is that we do our best to hide it in a location that would be very difficult to see unless somebody was trying to show it off and showing their arm. This procedure is also very nice because there's not a lot of significant pain and discomfort with the procedure. It's merely removing skin and some fat. Oftentimes I will perform liposuction in addition to the skin removal of the arms in patients who have a little extra fat, and we really want to shape it as good as possible. If you look at this patient again from the back view, you can see quite a big difference in her arm. That loose extra skin that was hanging down was really bothersome for her. Again, many women are self-conscious to be in a tank top in the summer months or in a bathing suit because they are really not comfortable with how their arms look. This also could be done on men as well who have had significant weight loss. And again, you can see from the back, you can't see the scar because it's located right along the lowest part of the arm. Here's another patient who had significant weight loss and had a lot of loose, stretchy skin. Again, very bothered by that, makes it hard to fit into short sleeve shirts, and again, self-conscious regarding the amount of skin there. Here you can see the scar. It's a little pink still. These scars tend to stay pink until probably 9 to 12 months. Scars anywhere on the body take about a full 12 months or a year to fully mature, meaning that they look their best at a year. We have a lot of things that we can offer patients between the time of surgery and their 1-year visit if they have concerns regarding the scar, such as scar gel, as well as laser treatments and sometimes injection of some steroids that can help with that. We monitor patients afterwards during the recovery so that if we do notice that the scars are looking slightly thicker and more prominent, we can start to treat them early on in order to get the best result possible. Here's that same patient. You can see here after procedure, the scar is not visible from the back area, and she has quite a big improvement in her arm. It's much more proportional to her body without the significant excess skin and tissue that she was dealing with prior to that. Patients will often ask if these procedures, such as arm lift surgeries, can be combined with other procedures, and the answer to that is yes. We take a lot of things into consideration when we discuss doing combined procedures. First and foremost, however, is patient safety and health. Patients who have good health overall and are considered good candidates for cosmetic surgery can have multiple procedures done in the same surgery. This is beneficial for you as it leads to one recovery and one episode of general anesthesia. However, some procedures take longer than others, and we have to be very aware of the time in the operating room as well as recovery. So there is a limit to how many procedures we can do. Generally speaking, the maximum amount of time we spend in the operating room for one particular patient for multiple procedures is about 6 hours. And this is because we want to maintain patient safety and have a good recovery afterwards. Our patients do go home. We are an outpatient surgery center, so we want to make sure we're doing very safe surgery. If patients have any other kind of health problems, issues, it may change the ability to combine the procedures as well. But in general, patients who are in good health can tolerate quite a few procedures done together. That summarizes the most common procedures that we see and do here on a daily basis in regard to our patients who have had significant weight loss. As I alluded to earlier, there's been so many great advances in technology when it comes to not only surgical techniques, but also recovery. As I mentioned earlier, recovery has been one of the biggest barriers for patients to consider surgery. Fear of being painful, fear of not being able to return to normal activities on an extended time period. The good news is that we have made great advances with technology and science and medicine. Our anesthesia doctors who perform the anesthesia for you are all excellent, well-trained physicians, and they do a great job of keeping you comfortable and sleepy and minimizing the amount of medication to help minimize the risk of nausea, vomiting, as well as problems with the recovery. We'd be very happy to see you at our office, either in person or offering as well virtual consultations. You can see on the screen our phone number at 616-588-8880. And you will, if you're interested in a consultation, you can call our office and one of our first impression team members will chat with you regarding your areas of interest and find a time that works to come into the office. In addition, Some of the photos that you've seen here and some additional photos are available on social media. The Instagram account for myself is Dr. David Alfonso, and I'd welcome you to follow me on Instagram. I like to post pictures of patients as well as pre-op and post-op results, in addition to some fun videos that you'll see if you go on my Instagram account of procedures that are performed in the operating room with kind of video images. It's a great way to learn about what's going on here. In addition, you can follow the Bankstone Center on Instagram as well. We oftentimes will post specials and what's new and current events that are going on in the field of aesthetic medicine and cosmetic surgery on the Instagram account as well. So I would encourage all of you to sign up and follow me. I think you'll find that there are some really neat things on there, and we like to add content on a fairly regular basis. So I appreciate everybody's attention and tuning in now. I hope this was an educational and informative experience, and we'll give it some time now. If anybody has any questions, that they can use their chat box feature or send questions through Haley, and I'd be happy to answer them regarding any of the surgical procedures we discussed today, as well as other procedures that patients may have. All right, we have a surgery or a question from a patient. It was, after surgery, do you provide some compression garments? And the answer is yes. After surgery, for most of the surgeries that we do, especially if it involves liposuction and body contouring areas, we provide you with compression garments. And those are garments that are put on either right at the end of surgery or the next day that we give you that help with swelling. We typically provide them for arm surgery as well as abdominal surgery and thigh surgery. There's a bunch of different types that are out there. Patients often will purchase some of their own online or at stores before surgery as well. The ones that we use are typically the ones that are best in the early phases of your healing, that are easy to get on when things are more swollen and tender. And then typically when patients are out about 2 weeks or so, they can start to transition into some of the more involved kind of shapewear or Spanx type of garments that patients will wear under their clothing. The nice thing is that these garments now have become way, way more fashionable and way more comfortable than they were even 10 years ago. And patients can be wearing these compression garments under their clothing back at work, and nobody would be aware that they had had a procedure done. The benefit of the compression wear is that you will look better faster. I tell patients 1 year after your surgery, if you used your compression garments every day like I instructed, or you never touched it once, you would still look the same. But patients look better in the 4 to 6 week time frame after surgery if they've been very, very consistent in regards to utilizing the compression garments. And that's because that's the time frame of the largest swelling, and that's where we want patients to be really active with the compression garments. That's going to help patients look much better and much faster. So yes, we do provide compression garments with virtually all of our procedures. Another question here, what is the schedule for return checkups after your procedure? For example, a tummy tuck and breast surgery. That's a great question. So as you know, we talked about, our surgeries are outpatient, so you go home the same day. And after that procedure, we typically see you back in about somewhere between 7 to 10 days. And so everything is really under the skin and covered up with some steri strips. So there really isn't anything in terms of sutures that need removed. We give it about 7 to 10 days because if we use the anterior fluid system, management system, that's about the time where it's ready to be taken out here in the office, and we do that for you. After that visit at 7 to 10 days, if everything is going well, then we typically see you back somewhere between 3 to 5 months. And then after that, closer to the year mark, somewhere between 9 to 12 months. Most of our postoperative photos, depending on the surgery and other factors, most of the postoperative photos are performed Some were between 10 to 12 months after surgery, where really patients are approaching the very, very end stages and their final result. So in the beginning, depending on the surgery, there are potentially more follow-ups than others, but most patients come within the first 3 to 4 months, plan on anywhere from 2 to 3 visits, and that's pretty typical. Depending on the surgery, if patients feel well, and we've obviously used the fast track and expedited recovery system, many patients are able to drive themselves to their first postoperative visit if they feel up to it. Again, the night of surgery, we want you to have a responsible adult with you as a chaperone, and you have to have a driver the day of your surgery to bring you to our facility and take you home, obviously because of the anesthesia that you're going to receive. So those are important details to kind of work out ahead of time. Another question, should I purchase certain pullovers for the procedures? I think the best thing to do is allow us to get the initial surgical garments on, and then once the swelling has come down a little bit and patients are more comfortable, that's when it's good to transition to some of the more store-bought type of garments.
Certain pillows.
Oh, pillows, yeah. Pillows also are used to kind of place behind patients. No real specific pillows. Patients have been creative, and I've heard of all different types of pillows, but most of the time we have you position a pillow behind your back and or under your legs after a tummy tuck, just to get comfortable in the bed, and we talked to you about that as well. So there's no real need to get any special, go out and buy a reclining bed or a specific reclining chair. Most patients are able to get in their bed and sleep with a slightly altered position comfortably. Okay. Those are all great questions. I'm glad everybody had the opportunity to view the webinar, and I encourage you to call our office if you have any questions. If you've been thinking about a procedure, we'd be happy to meet with you and talk with you and create a customized plan to get you to the best result possible. Thank you.